In this video, I'll cover 10 essential community pharmacist interview questions, providing expert guidelines, ideal responses, and real-life scenarios to help you excel in your interview. This is one of 15 videos designed to fully prepare you for a community pharmacist interview. So, let's begin. Question 61. What role does a community pharmacist play in managing chronic diseases? The following are guidelines on how to approach this question. Community pharmacists play a crucial role in managing chronic diseases by providing medication therapy management, patient counseling, and collaborating with healthcare professionals to optimize treatment outcomes. Employers ask this question to assess the candidate's understanding of their responsibilities in long-term disease management and their ability to support patients in adherence and lifestyle modifications. The interviewee should demonstrate clinical expertise, communication skills, and patient-centered care while emphasizing their role in health promotion and medication safety. Avoid giving a vague or overly general response that does not highlight specific interventions they provide for chronic disease management. Knowledge of PSI guidelines on patient counselling and the Irish Pharmacy Act 2007, which governs professional pharmacy practice in Ireland, is essential in effectively answering this question. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. As a community pharmacist, I play a key role in the management of chronic diseases by ensuring that patients receive the correct medications and understand how to take them effectively. I provide medication reviews, assess for drug interactions, and offer adherence support to help patients manage conditions such as hypertension, diabetes, and asthma. I also educate patients on lifestyle modifications, monitor their treatment progress, and refer them to GPS or specialists when necessary. Through structured medication reviews, I help prevent complications and improve patient outcomes. Additionally, I ensure compliance with PSI guidelines by providing comprehensive patient counseling and supporting public health initiatives such as smoking cessation and weight management programs. Example scenario. I remember when a patient with type 2 diabetes came to the pharmacy repeatedly requesting early refills for their metformin prescription. I took the time to have a private conversation and discovered that they were experiencing gastrointestinal side effects, leading to poor adherence. I explained the importance of consistent medication use, suggested taking the medication with food, and consulted with their GP, who adjusted the dosage and prescribed an extended-release formulation. As a result, the patient's symptoms improved, and they became more adherent to their therapy, ultimately achieving better blood glucose control. This experience reinforced how early pharmacist intervention can significantly impact chronic disease management and improve patient well-being. Question 62. What would you do if you suspect a patient is misusing prescription medication? The following are guidelines on how to approach this question. Employers ask this question to assess your ability to handle drug misuse while ensuring patient safety and adhering to legal and ethical standards. Your response should demonstrate strong clinical judgment, communication skills, and professionalism in addressing potential medication misuse. It is essential to show that you would take a patient-centered approach, ensuring confidentiality and non-judgmental communication while working within pharmaceutical regulations. Avoid making assumptions or immediately refusing to dispense without gathering all relevant information, as this could negatively impact patient care. You should have strong knowledge of the Misuse of Drugs Regulations, 2017, and PSI's guidance for pharmacists on the safe supply of medicines, which outline the legal obligations and professional responsibilities in handling controlled substances and suspected misuse. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If I suspect a patient is misusing prescription medication, I would first review their dispensing history and assess any patterns of early refill requests or frequent changes in prescribers. I would engage with the patient in a compassionate and non-judgmental manner, asking open-ended questions to understand their medication use. If I still have concerns, I would contact the prescriber to discuss my observations while ensuring patient confidentiality. If misuse is confirmed, I would offer supportive interventions, such as signposting the patient to addiction services or discussing safer alternatives with the prescriber. My goal would be to balance patient care, legal compliance, and professional responsibility in handling the situation. Example scenario. I remember when a patient repeatedly requested early refills of their benzodiazepine prescription. I reviewed their history and noticed similar patterns in the past. I spoke with the patient in a calm and supportive manner, asking if they were experiencing increased anxiety or difficulty managing their condition. They admitted to taking higher doses than prescribed due to rising stress. I contacted their GP, who adjusted their treatment plan and referred them to a counseling service. By addressing the issue with empathy and professional diligence, I ensured the patient received appropriate care while preventing further medication misuse. Question 63. How do you handle requests for emergency supply of medications? The following are guidelines of how to approach this question. Employers ask this question to assess a pharmacist's decision-making skills, knowledge of legal and professional obligations, and ability to balance patient care with regulatory compliance. The interviewee should demonstrate an understanding of when an emergency supply is appropriate, the legal framework governing such requests, and the steps required to ensure patient safety. The response should be structured and confident, emphasizing adherence to regulations while maintaining a patient-centered approach. The interviewee should avoid immediately agreeing to an emergency supply without verifying the request or displaying uncertainty about the legal requirements. In Ireland, pharmacists must adhere to Regulation 8 of the Medicinal Products, Prescription and Control of Supply, Regulations 2003, as amended, and PSI's guidance on the supply of prescription-only medicines in an emergency. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. When handling requests for an emergency supply, I first establish whether the patient has been prescribed the medication previously and assess the urgency of the situation. I verify the patient's details and medication history using the pharmacy records or the patient's GP, ensuring the request complies with Irish legislation. If the request meets the legal criteria, I provide the smallest quantity necessary and counsel the patient on the importance of obtaining a new prescription. If the request does not comply with regulations, I offer alternative solutions, such as advising the patient to visit an out-of-hours GP service or suggesting over-the-counter options where appropriate. Throughout the process, I document my decision thoroughly, ensuring full accountability. Example scenario. I remember when a patient arrived just before closing time requesting an emergency supply of Ramipril, which they had been taking for years for hypertension. After checking our pharmacy records, I confirmed they had a valid prescription history but had run out of medication unexpectedly. I contacted the local out-of-hours GP, who verified the prescription and confirmed the urgency. Since the request met the legal requirements, I supplied a small quantity to last until the patient could obtain a new prescription. Before they left, I provided counseling on adherence and emphasized the importance of requesting repeat prescriptions in advance. This ensured the patient's continuity of care while maintaining compliance with regulations. Question 64. How do you deal with a patient who is dissatisfied with their medication's effectiveness? The following are guidelines of how to approach this question. Employers ask this question to assess a pharmacist's communication skills, problem-solving abilities, and patient-centered approach. The response should demonstrate active listening, empathy, and the ability to provide clear explanations while maintaining professionalism. The pharmacist must also show an understanding of when to intervene, adjust treatment in collaboration with a prescriber, or provide reassurance about medication expectations. The interviewee should avoid being dismissive, defensive, or making unauthorized changes to the patient's medication. A strong understanding of PSI's guidelines on the patient consultation process and their medicines management framework is essential to ensure compliance with professional and ethical standards. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. I understand that medication efficacy can vary from patient to patient, and it is important to address their concerns with empathy and professionalism. First, I would listen attentively to understand the patient's specific issues and ask follow-up questions to gather relevant details. Then, I would explain how the medication works, expected onset of action, and factors that may affect its effectiveness, such as adherence or interactions. If needed, I would check their medication history, discuss alternative options, or suggest a consultation with their GP or prescriber for potential adjustments. Throughout the conversation, I would remain supportive and reassuring, ensuring the patient feels heard and confident in their treatment plan. Example scenario. I remember when a patient came in frustrated that their antihypertensive medication was not working after a week. I reassured them that some blood pressure medications take time to show full effect and asked if they were taking it at the same time daily, with or without food. Upon reviewing their medication history, I noticed they had been missing doses. I explained the importance of adherence and provided strategies to help them remember, like setting reminders. After following my advice, they returned weeks later to say their blood pressure had improved, appreciating the guidance and support. Question 65. What do you enjoy most about being a pharmacist? The following are guidelines on how to approach this question. Employers ask this question to assess your passion for pharmacy, your motivation, and your fit for the role. Your answer should demonstrate genuine enthusiasm for the profession, emphasizing aspects such as patient care, problem solving, teamwork, or the opportunity to make a difference in people's lives. Avoid giving generic answers or focusing solely on financial incentives, as this may make you seem unmotivated or disengaged. Instead, focus on meaningful experiences that highlight your dedication to patient-centered care. Additionally, familiarity with PSI's Code of Conduct for Pharmacists and the Pharmaceutical Society of Ireland, PSI, core competency framework is essential, as they emphasize professionalism, patient safety, and ethical responsibilities in pharmacy practice. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. What I enjoy most about being a pharmacist is the ability to make a real impact on people's lives every day. Whether it's helping a patient understand their medications, recommending a suitable treatment for minor ailments, or identifying potential drug interactions, I find great satisfaction in using my expertise to ensure safe and effective patient care. I also enjoy the collaborative aspect of the role, working alongside doctors, nurses, and other healthcare professionals to optimize treatments and improve health outcomes. The evolving nature of pharmacy, with ongoing learning and professional development, keeps me engaged and allows me to stay up to date with the latest clinical guidelines and treatments. Above all, building trusting relationships with patients and supporting them in managing their health and well-being is what I find most rewarding. Question 66. Tell me about a time when you had to manage a challenging situation with a patient. The following are guidelines of how to approach this question. Employers ask this question to assess your ability to handle difficult patient interactions while maintaining professionalism, empathy, and problem-solving skills. They expect you to demonstrate strong communication, conflict resolution, and decision-making abilities while ensuring patient safety and adherence to pharmacy regulations. When responding, avoid blaming the patient, giving vague answers, or appearing indecisive. Instead, provide a structured response that shows how you identified the problem, took appropriate action, and achieved a positive outcome. It is important to be familiar with the PSI Code of Conduct for Pharmacists and the Health Act 2007, which outline the responsibilities of pharmacists in patient care and professional conduct. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. In my role as a community pharmacist, I once encountered a patient who was upset because their prescription for a controlled medication had expired, and they demanded that I dispense it without a valid prescription. I remained calm and empathetic, acknowledging their frustration while clearly explaining that Irish law prohibits dispensing controlled substances without a valid prescription. I offered to contact their GP to facilitate an urgent renewal and suggested an alternative non-prescription option for symptom relief in the meantime. The patient initially resisted, but after reassuring them that their well-being was my priority, they agreed, and I successfully coordinated with their doctor to resolve the issue swiftly. Question 66. How do you stay organized in a busy pharmacy setting? The following are guidelines of how to approach this question. Employers ask this question to assess your time management, multitasking abilities, and attention to detail in handling prescriptions, patient counseling, and stock management. The best approach is to demonstrate your ability to prioritize tasks, use pharmacy management systems efficiently, and collaborate effectively with pharmacy staff to ensure smooth operations. You should also highlight your ability to remain calm under pressure and ensure patient safety while handling multiple responsibilities. Avoid giving vague or generic answers that do not demonstrate a structured approach to organization. In Ireland, knowledge of PSI's guidelines on good pharmacy practice and data protection regulations, GDPR, is essential when discussing pharmacy operations, as organization includes proper record keeping and handling sensitive patient data securely. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. In a busy pharmacy setting, I rely on a structured workflow to manage tasks efficiently. I prioritize dispensing based on urgency, ensuring that time-sensitive prescriptions, such as antibiotics or controlled drugs, are processed first. I use the pharmacy management system to track prescriptions, flag pending tasks, and minimize errors. Effective team communication is key, so I delegate tasks appropriately, ensuring that prescription preparation, stock management, and patient counseling run smoothly. Additionally, I perform regular stock checks and system updates to prevent medication shortages and ensure compliance with PSI standards for record keeping and safe dispensing. Example scenario. I remember when we had a particularly hectic day with an influx of acute prescriptions while also managing a medication delivery order. To stay on top of tasks, I quickly assessed the workload, assigned a technician to handle stock replenishment, and focused on verifying prescriptions while coordinating with the pharmacist on duty. We flagged urgent prescriptions, like antibiotics and pain relief, to be processed first. Despite the rush, we maintained accuracy by double-checking high-risk medications and following the double-checking protocol. As a result, we completed all prescriptions on time while maintaining patient safety and service quality, ensuring that no errors occurred despite the high workload. Question 67. How do you handle constructive criticism from a supervisor? The following are guidelines of how to approach this question. Employers ask this question to assess your self-awareness, adaptability, and professionalism in a workplace setting. A strong response should demonstrate your ability to accept feedback positively, learn from it, and improve your performance. Your answer should reflect a growth mindset, resilience, and a commitment to delivering high-quality pharmaceutical care. Avoid responding defensively, dismissing feedback, or implying that you rarely receive criticism, as this may indicate an inability to grow. In Ireland, PSI's Code of Conduct for Pharmacists emphasizes professionalism, accountability, and continuous professional development, which are essential when handling constructive feedback. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. I appreciate constructive feedback as an opportunity for growth and continuous improvement. In my role as a pharmacist, I understand that maintaining high professional standards is crucial, and feedback from a supervisor helps refine my skills and ensures patient safety and compliance with regulations. When I receive constructive criticism, I listen carefully, reflect on the feedback, and take proactive steps to implement the necessary improvements. I also view it as a chance to enhance my knowledge and become a better pharmacist. Ultimately, my goal is to provide the best pharmaceutical care while working collaboratively with my team and adapting to industry standards. Example scenario. I remember when I was advised by my supervising pharmacist to improve my communication with patients who have language barriers. Their feedback highlighted the importance of using simpler terms and ensuring patients fully understand their medications. To address this, I implemented visual aids and translated leaflets while also taking extra time to confirm patient understanding using their teachback method. As a result, I noticed a significant improvement in medication adherence and patient confidence. This experience reinforced my belief that constructive feedback is essential for professional growth and patient-centered care. Question 68. What qualities do you think are most important for a community pharmacist? The following are guidelines of how to approach this question. Employers ask this question to assess whether the interviewee understands the key competences required for a community pharmacist and whether they possess these qualities. The interviewee should highlight strong communication skills, attention to detail, problem-solving abilities, and a patient-centered approach, as these are crucial for ensuring safe and effective medication use. It is important to emphasize the ability to work under pressure, collaborate with healthcare professionals, and provide exceptional patient care. The interviewee should avoid giving generic answers or focusing solely on technical knowledge without discussing interpersonal skills and professional responsibility. A strong answer should also demonstrate knowledge of relevant Irish laws and PSI guidelines, such as the Pharmacy Act 2007 and the PSI Code of Conduct, which outline the professional and ethical obligations of a pharmacist. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. A community pharmacist must possess strong communication skills to effectively counsel patients, explain medication use, and liaise with healthcare professionals. Attention to detail is critical to ensure the safe dispensing of medications and to prevent errors. Empathy and patience are essential, as pharmacists work with diverse patients, including those who may be anxious or unwell. Problem-solving skills help in handling prescription issues, medication shortages, or patient concerns. Lastly, a strong sense of professionalism and ethical responsibility is crucial to maintaining compliance with Irish pharmacy regulations and providing high-quality patient care. Question 69. How do you ensure accuracy when dispensing medications? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's attention to detail, commitment to patient safety, and adherence to legal and professional standards. The interviewee must demonstrate a structured approach to dispensing, including checking prescriptions, verifying patient details, and cross-referencing potential drug interactions. Additionally, highlighting the use of standard operating procedures, SOPs, and technology, such as barcode verification systems, strengthens the response. The interviewee should avoid vague or generic answers that do not demonstrate a clear methodology for preventing errors. It is crucial to be familiar with PSI's guidelines on the safe supply of medicines and the medicinal products, prescription and control of supply, Regulations 2003, as amended, to ensure compliance with Irish law. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. Ensuring accuracy in dispensing is my top priority as a community pharmacist. I follow a structured process that includes carefully reviewing the prescription, confirming patient details, and cross-checking for allergens, interactions, or contraindications. I adhere strictly to standard operating procedures, SOPs, and utilize barcode scanning where available to minimize errors. Before finalizing a dispense, I always conduct a final check of the medication, dosage, and labeling, ensuring compliance with PSI guidelines. Lastly, I engage in continuous learning and team communication to maintain high standards in dispensing safety. Example scenario. I remember when a patient presented a prescription for warfarin alongside a newly prescribed NSAID. Recognizing the potential for increased bleeding risk, I reviewed the patient's history and contacted the prescribing doctor to discuss an alternative. After a thorough review, the doctor agreed to adjust the treatment plan, ensuring patient safety. This situation reinforced the importance of vigilance, communication, and adherence to dispensing protocols. By applying my knowledge and following PSI guidelines, I prevented a potentially serious adverse drug reaction. Question 70. What would you do if a GP prescribed a medication that a patient is allergic to? The following are guidelines on how to approach this question. This question assesses your clinical judgment, problem-solving skills, and patient safety awareness in a community pharmacy setting. Employers want to see that you can identify potential medication errors, communicate effectively with healthcare professionals, and prioritize patient safety. Your response should demonstrate a methodical and professional approach while ensuring that the patient receives appropriate treatment. Avoid giving a vague or overly simplistic answer that does not address how you would verify the allergy, document the issue, and communicate with the GP. It is also essential to be aware of the Pharmaceutical Society of Ireland, PSI, guidelines on safe supply of medicines and the Irish Medicines Board, IMB, regulations, which emphasize the pharmacist's duty to ensure safe and effective medication use. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If I notice that a GP has prescribed a medication that the patient is allergic to, my first step would be to verify the allergy with the patient and check their patient medication record to confirm the severity of the reaction. If the allergy is confirmed, I would immediately contact the GP to inform them of the issue and suggest a suitable alternative. Meanwhile, I would also educate the patient on the importance of allergy alerts and ensure that the dispensing record is updated to prevent future errors. My priority is always patient safety, and I would follow up with the GP's office to confirm that a new prescription has been issued before dispensing any medication. Example scenario. I remember when a patient came in with a prescription for coamoxiclav, but their record showed a penicillin allergy. I asked the patient about their reaction, and they confirmed experiencing severe anaphylaxis in the past. I immediately called the GP's office, and after discussing the case, the doctor prescribed clarithromycin instead. I documented the intervention in the patient's record and informed the patient about why the change was necessary. The patient was grateful for the proactive approach, and the GP appreciated the quick communication, reinforcing the importance of collaboration between healthcare professionals for patient safety. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with others. Subscribe to this channel and hit the notification bell so you never miss an update in the series that we are doing. For more learning resources, check the description below. See you in the next video.